that side, but her flexion and extension are good. They don't reproduce any pain, and the range of motion is pretty good. So I know normally we would probably jump right into the sagittal plane, but I wasn't necessarily thinking sagittal plane immediately with this one because her range of motion was good. In her frontal plane was where she was expressing the most a loss of motion. So that's where my mechanical thinking went at that moment anyway.
Mm-hmm. So where did you start your repeated movement exam?
Flexion rotation. I jumped right into flexion rotation toward that side.
Why would you not look at one of the losses with side glide or flexion?
I thought about that. I think it was strictly pattern recognition. I didn't jump right into, let's say, standing side glide or like shoulder against the wall side glide. And I think it might have had something to do with like what I noticed in the moment when she was going through the range of motion that made me unload and go to an unloaded technique as opposed to remain loaded. Because she is 69, older, and well, a little bit older.
Younger all the time,
as I get closer to that age, then all of a sudden it doesn't seem so old anymore.
Just a young kid, right? She's just
right. Yeah. So,
hey, Ryan, could it be that right side glide peripheralized symptoms?
yeah. Right side glide did not peripheralize symptoms when I tested her.
Okay, just the loss.
There's truly no effect. Yeah, it was just a loss of motion.
Okay.
And it may have been something with I think there may have been a level of discomfort that was associated with it. It's like with decisions like this, they happen so quickly. Like you're taking so many factors into consideration in a very short period of time that I'm sure it was something along the lines of pattern recognition. It's what I saw like in the moment when she was performing side glide, that she had a neural tension. And that's a good question. Why didn't I go into like side glide and standing?
I mean, it makes total sense to me why you'd go lateral.
Mm-hmm.
Because there's no loss of extension, there's no peripheralization that occurred, and she's got this loss in the frontal plane.
Mm-hmm.
She's got this, loss in deflection. And so, but at any rate, all right. So you went in flexion rotation, and that's patient generated or it's therapist generated?
Patient generated.
Okay.
So she did repeated, and usually what I like to do is if they have no terrible difficulties or significant pain with repeated flexion rotation, then I'll have them sustain it right after. I'll have them do about 10 repetitions of flexion rotation. Like, yeah, it feels a little stiff. Maybe it's loosening up. And on the last rep, I'll have them hold it for 1 to 2 minutes.
Mm-hmm. Okay.
So I did that with her. Then I went back and I rechecked those 2 big baselines I was referring to before, which was side glide toward that side and neural tension. So her neural tension, and I'm looking at the note right now, nearly resolved. So she had an immediate, almost like full knee extension plus dorsiflexion that was not nearly as painful or produced next to nothing. So because I put it as nearly resolved. Yeah, her knee was able to extend to 0 without pain. I made a note as well.
Ryan, did you just have her do the flip test or did you put her foot on that opposite chair?
So first I did the flip test. Yeah. So first I went through and I did my mechanical exams, and then we went to the chair. Yeah. So it was, let's check the flip test. Let's check your side glide. Side glide had improved. And then now let's put your foot up on the chair. Right. So it's the combination of her functional tests and then my mechanical exam.
Okay. And the foot on the chair also allowed for dorsiflexion with knee extension.
Yes. Yeah. Her knee extended to 0. And she was able to sit there for a prolonged period of time without having a progressive worsening. In fact, it didn't worsen at all. She was just kind of there. And she noticed it, right? It wasn't absolutely perfect, but it was a significant reduction. She went from 20 degrees.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.